Haroon Tulane is watching the spread of MPOX with dread. He was one of the first patients in Britain to become infected during the last global outbreak of the virus in 2022. It nearly killed him.
That 11 days at the hospital was probably the most devastating times of my life. I've never been in such pain all my life. My whole body was aching. I wasn't able to eat or drink or swallow. From then to now, it triggers some memories in me. I don't want to be that level of sick again in my life.
I came to see Haroon 2 years ago, just after he'd been discharged from hospital, but he was still isolating.
It was very scary. I thought that I'm by myself. I can't do this alone.
The variant of MPOX that is spreading right now is, we think, much more infectious than the strain that Haroon contracted in July 2022. We know from our experience with COVID that it's extremely difficult to try and contain these kinds of outbreaks. We know it's already in Europe, spread from Africa, and it's almost inevitable that it will get to the UK. In Central Africa, this outbreak has already claimed over 570 lives and infected more than 17,000 people. Pregnant women, young children, and anyone with underlying health conditions is most at risk. MPOX can be passed on from person to person through any close physical contact with MPOX blisters or scabs, or by touching clothing, bedding, or towels used by someone with MPOX, or through the coughs or sneezes of a person infected with the virus. It usually takes between 5 and 21 days for the first symptoms to appear, and these can include a fever, a headache, and muscle aches. A rash usually appears 1 to 5 days later.
I think it's quite likely that cases are already in other countries in Europe, and including the United Kingdom, but we won't necessarily know for a while.
Haroon says there was a shortage of available MPOX vaccines in 2022, particularly for high-risk groups like men who have sex with men. But the advice for vaccinations this time has changed.
There is vaccine available in the UK, and currently it will be mainly used in the context of post-exposure prophylaxis and will not be given in advance to people travelling to countries.
This is the second MPOX global health emergency in as many years. It's hoped the lessons learned then can help to minimise the risk now. Ashish Joshi, Sky News.